Question 1. You are working at an animal care facility and notice that a dog is showing signs of distress, including panting heavily, drooling, and acting agitated. You suspect that the animal is in pain but cannot identify the cause. What is the most appropriate course of action for you to take in this situation? A. Immediately attempt to restrain the dog for examination. B. Observe the animal for a few hours and see if the symptoms subside. C. Contact the veterinarian or supervisor to assess the situation and provide guidance. D. Administer an over-the-counter painkiller to alleviate the symptoms. Answer: C. Contact the veterinarian or supervisor to assess the situation and provide guidance. Explanation: in cases where an animal exhibits signs of distress, especially when the cause is not immediately apparent, the most appropriate action is to contact a veterinarian or supervisor who has the necessary expertise to diagnose and manage the situation. Administering medication without professional guidance can cause harm, and simply observing for hours could allow the situation to worsen. Restraining the animal without understanding the underlying issue could increase stress or cause injury, and thus should be avoided. Veterinary professionals are trained to recognize signs of distress and manage pain appropriately. Question 2. Mr. Taylor, a professional animal handler, is tasked with handling a frightened rabbit that has recently arrived at the shelter. He needs to restrain the rabbit to administer a medical checkup, but he is concerned that physical restraint may cause stress to the animal. What is the safest and most effective restraint method for Mr. Taylor to use in this scenario? A. Use a mechanical restraint device like a rabbit restraint cage to immobilize the animal. B. Gently hold the rabbit with both hands, ensuring minimal pressure on the body while maintaining control. C. Use a chemical restraint to sedate the rabbit before handling. D. Restrict the rabbit's movement by placing it in tight enclosure without using any physical restraint. Answer: B. Gently hold the rabbit with both hands, ensuring minimal pressure on the body while maintaining control. Explanation: when handling animals that are frightened or anxious, minimizing stress is a priority. For a rabbit, gentle physical restraint by holding the animal securely but not too tightly is often the most appropriate technique. This method provides control while also avoiding causing undue stress or harm. Using a mechanical device increase the rabbit's anxiety, while chemical restraint should only be used under veterinary guidance. Tight enclosures without restraint may lead to injury, as rabbits can attempt to escape in confined space. Question 3. Scenario-based. Sarah is an animal care worker at a shelter and has just received a kitten that has been found abandoned in the streets. Upon inspection, the kitten appears malnourished and has difficulty walking with slight swelling around its hind legs. Sarah has limited information about the kitten's background and condition. What should Sarah do next to ensure the kitten receives appropriate care? A. Immediately feed the kitten with any food available and allow it to rest for the next 24 hours. B. Contact a veterinarian for a thorough assessment of the kitten's health, focusing on hydration, malnutrition, and injury. C. Start vaccination schedule for the kitten to ensure it is protected from potential diseases. D. Administer pain relief medications and put the kitten in comfortable environment to rest. Answer: B. Contact a veterinarian for a thorough assessment of the kitten's health, focusing on hydration, malnutrition, and injury. Explanation: in situations where an animal's condition is uncertain and potentially severe, the first step is always to consult with veterinarian. The kitten's malnourishment and difficulty walking could indicate serious health issues such as dehydration, infections, or musculoskeletal injuries. Veterinarian will perform thorough examination and provide the necessary treatment or further care plans. While feeding and resting the kitten may seem like appropriate steps, they should be done under professional guidance to avoid complications, such as feeding the wrong type of food. Vaccination schedules should be followed after the kitten has been stabilized and assessed for any underlying health conditions. Question 4. A veterinary technician at an animal care facility is preparing to administer medication to a dog with a chronic skin infection. The medication must be injected directly into the dog's muscles. What is the proper technique for administering an intramuscular injection to ensure the dog's safety and minimize discomfort? A. Insert the needle quickly and at 45-degree angle into the muscle, avoiding the bone and major blood vessels. B. Use the largest needle available for the injection and insert it slowly to ensure proper absorption. C. Insert the needle at 90-degree angle to the skin, ensuring it penetrates deeply into the muscle. D. Insert the needle at 30-degree angle to the skin, keeping the needle in the subcutaneous layer for slower release. Answer A. Insert the needle quickly in a 45-degree angle into the muscle, avoiding the bone and major blood vessels. Explanation. When administering an intramuscular injection, the needle should be inserted at a 45-degree angle, allowing it to penetrate the muscle without hitting the bone or major blood vessels. The injection should be given quickly to minimize discomfort and reduce the risk of accidental injection into subcutaneous tissues. A 90-degree angle may be too steep and risk hitting bone, while a 30-degree angle may not deliver the medication into the muscle. The needle should be of appropriate size for the muscle tissue, and care should be taken to avoid overusing the needle size or insertion speed. Question 5. A manager at an animal care facility is reviewing the protocols for managing waste in the facility's animal enclosures. Which of the following actions would best prevent the spread of infectious diseases among the animals? A. Clean animal enclosures once a week and disinfect the surfaces using only water. B. Ensure that animal waste is collected immediately and that enclosures are disinfected regularly using suitable disinfectant. C. Allow waste to accumulate and remove it only when necessary to prevent disturbing the animals. D. Use bleach exclusively to disinfect all surfaces, regardless of the type of animal. Answer. B. Ensure that animal waste is collected immediately and that enclosures are disinfected regularly using a suitable disinfectant. Explanation. To prevent the spread of infectious diseases, it is essential to immediately collect waste from animal enclosures and disinfect the surfaces regularly. This reduces the chances of pathogens spreading and ensures that the environment remains sanitary. Using water alone will not effectively eliminate bacteria, viruses. Accumulating waste can foster the growth of harmful pathogens, while using bleach indiscriminately can damage surfaces and may not be the best choice for all types of enclosures. Always choose an appropriate disinfectant for the specific materials and species involved. Question 6. Sarah works in an animal care setting and is tasked with assessing the nutritional needs of a dog that has been diagnosed with obesity. What is the first step in addressing the dog's condition? A. Increase the dog's exercise routine immediately to promote weight loss. B. Cut the dog's food intake by 50% to reduce its weight quickly. C. Consult with veterinarian to create tailored weight management plan that includes dietary and exercise changes. D. Continue feeding the dog the same amount of food, but add daily supplement to boost its metabolism. Answer. C. Consult with a veterinarian to create a tailored weight management plan that includes dietary and exercise changes. Explanation. The first step in managing obesity in an animal is consulting with a veterinarian to create a tailored weight management plan. This plan will consider the dog's health status, age, activity level, and medical conditions. A veterinarian may recommend adjustments in the dog's diet and exercise routine, ensuring changes are gradual and sustainable. Dramatic reductions in food intake, such as cutting food by 50% or an immediate increase in exercise, could cause stress or health complications. Supplements are not a substitute for proper dietary and lifestyle changes. Question 7. Scenario-based. You are an animal care worker at a shelter and a client arrives with her cat that has been experiencing vomiting and lethargy for the past 2 days. The client appears concerned but is unsure of the severity of the symptoms. What should you do next? A. Immediately administer fluids and check the cat's temperature to ensure it is not dehydrated. B. Reassure the client and suggest waiting another day to see if the symptoms resolve on their own. C. Assess the cat's overall condition, including taking vital signs, and recommend that the client seek veterinary care if symptoms persist. D. Tell the client that vomiting is normal and ask them to monitor the cat for a few more days without intervention. Answer. C. Assess the cat's overall condition, including taking vital signs, and recommend that the client seek veterinary care if symptoms persist. Explanation. In cases of vomiting and lethargy, especially when they persist for more than 24 hours, it is crucial to assess the cat's overall condition. Take vital signs, temperature, heart rate, respiratory rate, to determine whether the symptoms indicate an underlying health issue. If the cat's condition does not improve, recommending veterinary care is essential, as vomiting and lethargy could signal a range of potential problems such as infections, parasites, or other serious conditions. Simply reassuring the client without taking action or recommending no intervention could lead to delay in necessary medical treatment. Question 8. An animal care worker notices that a rabbit has begun to exhibit signs of aggression, such as thumping its hind legs, growling, and attempting to bite. What should the worker do next to handle the situation safely? A. Attempt to grab the rabbit quickly and hold it firmly to prevent further aggression. B. Leave the rabbit alone to calm down, ensuring it has a quiet environment and enough space to retreat. C. Use a chemical restraint to sedate the rabbit and calm it down. D. Restrain the rabbit with a leash to prevent movement and reduce the risk of biting. Answer: B. Leave the rabbit alone to calm down, ensuring it has a quiet environment and enough space to retreat. Explanation: aggressive behaviors in rabbits can often stem from fear or stress. The most appropriate action is to leave the animal alone in a quiet environment where it can feel secure and retreat to a safe area. This helps to reduce the chances of further stress or aggression. Restraining the rabbit too quickly may cause it to escalate its behavior. Chemical restraint should be used only under veterinary supervision, and using a leash can further aggravate the animal, leading to injury or stress. Question 9. During a routine health check, an animal care worker notices that a dog shows symptoms of skin irritation, hair loss, and excessive scratching. What should be the first step in determining the cause of these symptoms? A. Immediately treat the dog with over-the-counter antifungal cream. B. Perform a thorough examination to rule out external parasites and refer the dog to a veterinarian for further diagnostic tests. C. Recommend a change in diet to address potential allergies and observe the dog's condition over the next few days. D. Apply topical steroids to alleviate the symptoms and monitor for any improvement. Answer: B. Perform a thorough examination to rule out external parasites and refer the dog to a veterinarian for further diagnostic tests. Explanation: skin irritation, hair loss, and excessive scratching can be caused by a variety of factors, including external parasites, e.g., fleas, mites, allergies, or infections. The first step in diagnosing the issue should be a thorough examination of the dog, including checking for parasites. Essential to rule out these causes before beginning treatment. After a proper examination, referral to a veterinarian for diagnostic tests, such as skin scrapings or blood tests, is necessary to identify the underlying cause and provide appropriate treatment. Using over-the-counter treatments or steroids without knowing the cause could worsen the condition or mask the underlying problem. Question 10. In an animal care facility, the staff is discussing strategies to reduce stress in animals during handling. Which of the following is the most effective technique to minimize stress during handling and restraint? A. Restrain animals as firmly as possible to prevent them from escaping during procedures. B. Use a calm, gentle approach when handling animals and allow them time to adjust to new environments and situations. C. Handle the animals quickly to minimize the time they are restrained. D. Always use physical restraint over chemical restraint, as it is safer and less invasive. Answer: B. Use a calm, gentle approach when handling animals and allow them time to adjust to new environments and situations. Explanation: minimizing stress during handling is crucial for animal welfare. A calm, gentle approach helps animals feel more secure and reduces the risk of fear-induced aggression or injury. Giving animals time to adjust to new environments and situations allows them to acclimate gradually. Restraining animals firmly or quickly can increase their stress levels and lead to physical harm. While physical restraint can sometimes be necessary, it should always be used sparingly and in a way that minimizes discomfort, with chemical restraint being an option only when appropriate and under veterinary guidance. Question 11. A shelter worker is introducing a new cat to an enclosure shared with other cats. What is the best approach to ensure a smooth transition and reduce stress for all animals involved? A. Place the new cat directly into the shared enclosure to let it establish dominance. B. Keep the new cat in a separate area to allow the scent to mingle with the other cats before physical introduction. C. Allow the new cat to roam freely in the enclosure while monitoring for aggressive behavior. D. Introduce the new cat to the others during feeding time to encourage bonding. Answer: B. Keep the new cat in a separate area to allow the scent to mingle with the other cats before physical introduction. Explanation: cats are territorial and sensitive to changes in their environment. Allowing them to become familiar with the new cat scent through gradual introduction helps reduce stress and aggressive behavior. Immediate physical introduction can lead to fights and stress for both the new and existing cats. Feeding time should be a calm act, not a time for introductions, as it can trigger resource guarding behaviors. Question 12. During a routine examination, an animal care worker notices a guinea pig with overgrown teeth. What should the worker do to address this issue? A. Provide the guinea pig with more hard pellets to chew. B. File down the teeth using tools without veterinary supervision. C. Refer the guinea pig to a veterinarian for proper dental care. D. Reduce the guinea pig's food intake to prevent further tooth growth. Answer: C. Refer the guinea pig to a veterinarian for proper dental care. Explanation: guinea pigs' teeth grow continuously and overgrowth can cause pain, difficulty eating, and other health issues. A veterinarian should assess and address dental problems to ensure proper care. Overgrown teeth are a medical issue that cannot be corrected by simply providing hard food or reducing food intake. Filing teeth without training or veterinary oversight can harm the animal. Question 13, scenario-based. A dog in an animal care facility is refusing to eat and has been lethargic for 2 days. What is the most appropriate first step for the care worker? They offer the dog a different type of food to see if it prefers another option. B. Monitor the dog for 1 more day before taking further action. C. Check the dog's hydration, temperature, and overall condition and consult veterinarian immediately. D. Assume the dog is adjusting to its new environment and take no action. Answer: C. Check the dog's hydration, temperature, and overall condition, and consult veterinarian immediately. Explanation: refusal to eat and lethargy for more than 24 hours can indicate serious health issue. Checking the dog's hydration and vital signs provides essential information, but consultation with veterinarian is necessary to diagnose and address the underlying cause. Waiting longer or assuming the behavior is due to environment adjustment could delay treatment. Question 14. A rabbit in a shelter exhibits frequent sneezing, nasal discharge, and decreased appetite. What should the shelter worker do to manage these symptoms? A. Increase the rabbit's exposure to fresh air and monitor its condition. B. Administer over-the-counter cold medication suitable for small animals. C. Isolate the rabbit from others and consult veterinarian to assess potential respiratory infection. D. Adjust the rabbit's diet to include more fiber-rich foods to boost immunity. Answer: C. Isolate the rabbit from others and consult a veterinarian to assess potential respiratory infection. Explanation: sneezing, nasal discharge, and decreased appetite are signs of potential respiratory infection in rabbits, which can be contagious and serious. Isolating the rabbit prevents the spread of infection to other animals, and a veterinarian can provide appropriate treatment. Over-the-counter medications are not recommended for rabbits without veterinary guidance, and diet changes alone cannot resolve an infection. Question 15. An animal care worker is tasked with cleaning and disinfecting a kennel used for dogs with gastrointestinal illness. What is the correct procedure to ensure the kennel is thoroughly sanitized? A. Rinse the kennel with water and allow it to air dry. B. Use a disinfectant approved for animal care facilities, ensuring all surfaces are scrubbed and disinfected properly. C. Apply a strong bleach solution directly to all surfaces without rinsing to ensure disinfection. D. Clean only the visibly soiled areas to reduce chemical exposure. Answer: B. Use a disinfectant approved for animal care facilities, ensuring all surfaces are scrubbed and disinfected properly. Explanation: to prevent the spread of infectious diseases, all surfaces of the kennel should be cleaned and disinfected thoroughly using an approved disinfectant for animal care settings. Scrubbing ensures that organic material is removed, which can interfere with disinfectant effectiveness. A strong bleach solution may be harmful to animals and staff if not used correctly, and cleaning only visibly soiled areas is insufficient for proper sanitation. Question 16. A shelter has received a litter of orphaned kittens that are 2 weeks old. What is the most appropriate way to feed them? A. Use cow's milk as substitute for their mother's milk. B. Provide dry kitten food soaked in water. C. Feed them with kitten milk replacer using bottle or syringe. D. Offer them wet cat food designed for adult cats. Answer: C. Feed them with a kitten milk replacer using a bottle or syringe. Explanation: orphaned kittens require a kitten milk replacer as it provides the necessary nutrients for their development. Cow's milk and adult cat food are not nutritionally appropriate and may cause digestive issues. At 2 weeks old, kittens are not ready for solid food, even if it is softened. Question 17, scenario-based. During a daily check, a shelter worker observes a parrot that is excessively plucking its feathers and displaying signs of stress. What should the worker prioritize to improve the parrot's condition? A. Increase the parrot's food portions to reduce boredom. B. Provide enrichment items, such as toys, and ensure the parrot has sufficient social interaction. C. Move the parrot to smaller, quieter enclosure. D. Trim the parrot's feathers to prevent further plucking. Answer: B. Provide enrichment items, such as toys, and ensure the parrot has sufficient social interaction. Explanation: feather plucking in parrots is often a sign of stress, boredom, or lack of stimulation. Providing enrichment and interaction can help reduce stress and redirect the bird's energy. Moving to smaller enclosure or trimming feathers does not address the underlying cause. Increasing food portions alone will not resolve behavioral issues. Question 18. What is the most effective method to prevent the spread of zoonotic diseases in an animal care facility? A. Requiring all animals to wear protective gear. B. Regularly washing hands, cleaning enclosures, and following vaccination protocols for animals and staff. C. Restricting access to high-risk animals, such as reptiles and birds. D. Limiting the time spent handling animals. Answer: B. Regularly washing hands, cleaning enclosures, and following vaccination protocols for animals and staff. Explanation: zoonotic disease prevention relies on hygiene, regular cleaning, and vaccinations to protect both humans and animals. Restricting access to certain animals or limiting handling time does not eliminate the risk of disease transmission. Proper hygiene practices and preventive measures are the most effective. Question 19. A shelter is housing a senior dog that has begun showing signs of arthritis, such as difficulty standing and reduced mobility. What is the best course of action? A. Increase the dog's exercise to strengthen its muscles. B. Provide soft, supportive bed and consult veterinarian for pain management options. C. Administer over-the-counter pain relief intended for humans. D. Encourage the dog to remain active by placing its food and water in elevated locations. Answer: B. Provide a soft, supportive bed and consult a veterinarian for pain management options. Explanation: senior dogs with arthritis benefit from a comfortable environment and proper medical care. A veterinarian can recommend appropriate treatment and pain management options. Human medications should never be given to animals, as they can be toxic. Placing food and water in elevated locations or increasing exercise can exacerbate pain. Question 20. A rabbit in a care facility has matted fur and small white specks near its ears. What is the appropriate next step? A. Brush the rabbit's fur thoroughly and monitor its condition. B. Bathe the rabbit in warm water to remove the mats and specks. C. Consult veterinarian to evaluate for mites or other skin conditions. D. Isolate the rabbit and use an over-the-counter treatment for mites. Answer: C. Consult a veterinarian to evaluate for mites or other skin conditions. Explanation: small white specks near the ears may indicate mites or other skin issues, requiring veterinary diagnosis and treatment. Bathing rabbits is stressful and can lead to health complications. Over-the-counter treatment should not be used without veterinary guidance, as improper use can harm the animal. Question 21. An animal shelter receives a young puppy that has not been vaccinated. What is the most appropriate initial action? A. Introduce the puppy to other animals to socialize it. B. Administer a full set of vaccines immediately upon arrival. C. Isolate the puppy until it has been examined by a veterinarian and vaccinated. D. Feed the puppy and allow it to roam freely in the shelter. Answer: C. Isolate the puppy until it has been examined by a veterinarian and vaccinated. Explanation: unvaccinated puppies are at high risk of contracting and spreading infectious diseases. Isolation and a veterinary examination are crucial to ensure the puppy's health and the safety of other animals in the shelter. Question 22, scenario-based. A cat in a shelter starts sneezing frequently and has a runny nose. What is the best course of action? A. Monitor the cat for a week to see if symptoms improve. B. Isolate the cat and consult a veterinarian to evaluate for upper respiratory infections. C. Increase the cat's food portions to support its immune system. D. Clean the cat's nose regularly and provide additional bedding. Answer: B. Isolate the cat and consult a veterinarian to evaluate for upper respiratory infections. Explanation: frequent sneezing and nasal discharge in cats are common symptoms of upper respiratory infections, which can be contagious. Isolation and veterinary consultation are essential to prevent the spread of illness and to provide appropriate treatment. Question 23. What is the safest way to handle an aggressive dog in a shelter setting? A. Approach the dog calmly and avoid direct eye contact. B. Use a leash to restrain the dog immediately. C. Speak loudly to assert dominance over the dog. D. Sedate the dog before attempting to handle it. Answer A. Approach the dog calmly and avoid direct eye contact. Explanation. Approaching an aggressive dog requires calm, non-threatening behavior. Avoiding direct eye contact reduces the perception of threat. Restraining or sedating the dog prematurely may escalate aggression or cause harm. Question 24. A rabbit at the shelter is refusing to eat and appears lethargic. What is the most appropriate immediate action? A. Provide fresh hay and wait to see if the rabbit eats. B. Force feed the rabbit small amounts of food. C. Consult a veterinarian immediately as rabbits can deteriorate quickly. D. Change the rabbit's diet to include more fruits and vegetables. Answer C. Consult a veterinarian immediately as rabbits can deteriorate quickly. Explanation. Rabbits have sensitive digestive systems and a lack of appetite can quickly lead to serious complications such as gastrointestinal stasis. Immediate veterinary attention is necessary to determine the cause and provide treatment. Question 25. Which of the following is an important consideration when designing an enclosure for reptiles in a shelter? A. Providing constant access to direct sunlight. B. Ensuring the enclosure is large enough for the reptile to roam freely. C. Maintaining species-specific temperature, humidity, and lighting conditions. D. Keeping multiple reptiles of different species in the same enclosure for space efficiency. Answer C. Maintaining species-specific temperature, humidity, and lighting conditions. Explanation. Reptiles have specific environmental requirements, including temperature, humidity, and lighting, that must be tailored to their species. Direct sunlight, overcrowding, or generalized enclosures can lead to stress or health problems. Proper care ensures their well-being in a shelter environment. Question 26. What is the primary purpose of microchipping pets in an animal shelter? A. To track the animal's behavior and health. B. To provide permanent method of identification for lost or adopted pets. C. To monitor the animal's movement within the shelter. D. To ensure compliance with shelter vaccination policies. Answer B. To provide a permanent method of identification for lost or adopted pets. Explanation. Microchipping is a reliable way to identify pets and reunite them with their owners if they are lost. It provides essential information that links the pet to its guardian through a registered database. Question 27. Scenario-based. A shelter receives a stray dog showing signs of severe malnutrition and dehydration. What is the best approach to care for this dog? A. Feed the dog a large meal immediately to restore energy levels. B. Provide small, frequent meals and access to fresh water and consult a veterinarian. C. Place the dog in a general enclosure to reduce stress. D. Administer intravenous fluids without veterinary supervision. Answer B. Provide small, frequent meals and access to fresh water and consult a veterinarian. Explanation. Malnourished and dehydrated animals require gradual reintroduction of food and fluids to avoid complications such as refeeding syndrome. Veterinary guidance is critical to develop a proper care plan. Question 28. Which of the following is a critical component of disease control in an animal shelter? A. Regularly rotating animals between enclosures. B. Using shared feeding bowls to save resources. C. Cleaning and disinfecting enclosures and equipment daily. D. Limiting access to vaccinations to only severely ill animals. Answer C. Cleaning and disinfecting enclosures and equipment daily. Explanation. Maintaining cleanliness and proper disinfection practices helps control the spread of infectious diseases in a shelter. Shared equipment and poor hygiene can increase the risk of outbreaks. Question 29. What is the safest way to transport an injured animal to the veterinarian? A. Restrain the animal tightly in a carrier to prevent movement. B. Place the animal on a secure surface and minimize handling during transport. C. Hold the animal firmly in your arms throughout the journey. D. Allow the animal to move freely in the vehicle to reduce stress. Answer B. Place the animal on a secure surface and minimize handling during transport. Explanation. Injured animals should be transported on a stable, secure surface to prevent further injury. Limiting handling minimizes stress and avoids exacerbating the injury. Question 30. What is a key consideration when introducing a new cat into a communal shelter environment? A. Allow the new cat to roam freely to adjust quickly. B. Condo. A gradual introduction after an isolation period. C. Immediately place the new cat with other cats to assess compatibility. D. Focus on reducing feeding times to encourage cooperation. Answer: B. Conduct a gradual introduction after an isolation period. Explanation: new cats should be isolated initially to monitor for signs of illness and ensure vaccinations are up to date. Gradual introduction allows the cat to acclimate and minimizes stress or potential conflict with other animals.